Frequent exposure to death and dying has a positive effect on the lives of palliative care workers. That's the finding of a new study in the Canadian Medical Association Journal. The study is based on interviews with doctors, nurses, psychologists, and spiritual care professionals who care for dying patients. Dr. Shane Sinclair is the study's author. He's an adjunct lecturer at the Department of Oncology at the U of C's Faculty of Medicine, and he's the spiritual care coordinator with the Tom Baker Cancer Centre, and he joins me in the studio. Good morning.
Good morning.
What did palliative care workers tell you about why they chose to work with dying patients?
Well, they told me basically, in short, that working with dying people, unlike what we probably think as a society would be a very depressing and kind of morbid area to work in, actually enhanced areas such as meaning in life, caused them to look at things like spirituality a little bit more seriously, and really gave their life a greater sense of purpose as a result of working with these people at the end of their life.
Did they tell you how those two things were connected, how their work with people who are dying actually enhanced, for example, their spiritual life?
Yeah, no, a lot of them spoke of really not having a sense of a spiritual life before this, although it was certainly there, but maybe in a more latent kind of a form. And as they worked alongside of dying individuals, it caused them to really reflect deeply inward and deeply outward to, what does it mean to be a true human being, and who am I, and how do I fit into the broader framework of what life is really all about. And so basically there was a fair amount of reciprocity that was going on between dying people and these healthcare professionals, where questions that dying people were asking themselves in terms of what meaning does my life have, what is this all ultimately about, it caused healthcare professionals to ask the very same questions that their dying patients were asking. So they were constantly looking at their own life and saying, okay, I just met a dying person who has a lot of regrets, for example. How do I ensure that doesn't happen? Or how do I, at the very least, try to do the best I can that I'm not going to have regrets, like that at the end of my life? Or this person seems to be a person that I want to emulate my life after. What are the ingredients that I see in this person that I want to kind of bring into my own life and become more like? So a lot of it, in terms of spirituality, had to do with reflecting on what life is about, but also, self-authenticity. Who am I? And where I find myself right now as a healthcare professional in the busyness of life, how is it, aligning with what I consider to be my true self?
Why did you want to look at this and study this in the first place?
I've worked with people at the end of life for 7 years prior to working in the cancer center. So like any researcher, I think you sort of see things at the bedside that are important. And for example, these things, I think, are things that are very much common sense in some sense. I mean, looking at mortality has been something that wisdom traditions, religions, philosophies, dying people have been telling us is a valuable insight. And really, this was just a way of looking at it through a more empirical type of a lens. So as a spiritual care professional in my job, I saw the importance of this, not only for patients, but I saw the benefit in my own life. I'm a young guy. I probably have had a chance to reflect on things that most people in my demographic and age group just haven't had the opportunity to really look at in terms of, what's important. And so in some sense, it's an opportunity in this study. It was an opportunity really to deal with death in a more prospective fashion, rather than waiting, for the time and the circumstance to dictate when we'll deal with it. It was an opportunity for these individuals to really look at it. And as a result of looking into death and dying, their own mortality, these individuals indicated that their lives were enhanced significantly around things like meaning and purpose. And their practices as healthcare professionals actually changed. And so they actually saw themselves or perceived themselves to be more compassionate, more, focused on the person rather than just the patient. So I think that's where the exciting results are for me, because at the end of the day, a published paper in CMAJ is great, but if it doesn't change practice, it doesn't change, the care that we provide people, then I really think it's for naught, to be quite honest with you.
Do you think as well, I mean, I don't know how many people are attracted to the palliative care field, but Is it possible that this kind of study could actually attract more people to work with end-of-life patients?
Yeah, I think so. And I think a lot of people are attracted to palliative care, just symbolically what it means. It's not a label that I necessarily want to have over my head. And it's certainly a conversation stopper, let me tell you, at parties and things like that, in terms of, what you do for work. So, but I do think what the study does is it actually says to, new medical students, new nursing grads, palliative care may not be as scary and a dark area as you might have thought. And someone in this study actually said, they found the most alive people working in palliative care. And I just think that resonates with not only my own practice, but the research in general.
Well, thank you so much for coming in this morning.
Thank you.
Dr. Shane Sinclair is an adjunct lecturer at the Department of Oncology at the University of Calgary's Faculty of Medicine. He's also the spiritual care coordinator with the Tom Baker Cancer Centre. His study is published in the Canadian Medical Association Journal.